it's Dr. Chalmers. Welcome to another episode of Wellness Insights with Dr. Chalmers. And we're talking more about ketamine, and we're talking about the setting intentions and things that we're doing to make everything really kind of function a lot better. And so, I was talking about some stuff, and Scott Richardson and I kind of got tangled together, and we kind of walked through what we're going to do. So Scott, walk us through with what you were doing ahead of time, like what you've done, what your experience with ketamine is so far.
Do you want me to talk about what led up to it, why I do it, or like what was not working?
If you're comfortable with that, if you're comfortable with how how you got into it, what's going on, like what's your goal?
Yeah, I'm fine. So last year on January 1st, 2022, my mom passed away from COVID pneumonia. 2 weeks, she was only 66. That was unexpected. She approved her own vent and everything. So and then 9 hours later, she was gone. So, and then 2 weeks after that, my dad, he was only 69. They've been married for 47 years though. The doctors basically said he disconnected from his cortex somehow. And I had to make the decision to take him off life support and watch him pass away. That was literally the week of my mom's funeral. And then 9 months after that, we had my mother-in-law, who me and my spouse were taking care of, passed away in October. So literally 9 months after that, she went into the hospital, and she was for a stroke. And she ended up getting COVID while she was in there. And she was a end-stage COPD patient, dialysis patient, and several other things. And the COVID, mixed with the COVID, it took her out. So within 9 months, we lost 3 out of our 4 parents. So that's a lot mentally to deal with. So that's kind of, and it'd been almost 2 years. Or actually, this is the first year we haven't had to deal with any deaths. So nothing was working. I felt like I'm stuck. I felt like I didn't care anymore about life in general.
Mm-hmm.
I didn't find any joy in things. I love my nephews to death. I don't have any kids. My wife has a 28-year-old son. I think 28 or 29 now. And that's my stepson, but my nephews, and since he's older, my nephews are younger, and I didn't find any joy. All I found was despair. Trying to think of the right words. Not depression so much, but just no joy in life. Period. I'd watch them, and all I could think about was my parents. All I could think about, and the joyful times that you're supposed to be enjoying in life, that's all I could think about is, well, my mom and dad aren't here to enjoy this with me. My mom would love this. My dad would love this. And so that made the times that you're supposed to be enjoying life, that make life worth living, that made them very hard to deal with. So we have a mutual friend that posted that he had tried ketamine, and I was already kind of searching myself for different things like ayahuasca and stuff like that. And then we had a mutual friend post that he did ketamine treatments. And so I started to look into that, because I would rather do it, with somebody that knows what they're doing than willy-nilly do it myself. And then I'm on an Aaron Rodgers trip, and I'm,
Yeah.
So yeah, so I got into that, and I have a thing with needles. I pass out. So I couldn't do the intravenous thing. So I decided to do at home and the dissolvable tablets. And I think they work I don't think they work as well as intravenous, but I think with my condition, I'm not able to. I trip out when I go get needles.
Yeah,
so
IV and IEM is usually a little bit faster and a little bit easier to take this, but the orals, they'll get you there.
Okay. Yeah. So that's kind of what led me into doing this, because I didn't want to be on pills. I'm on Cymbalta. I was on Cymbalta. I still am. And I tried to get off Cymbalta, and that was Yeah, that was like the second, besides seeing my mom and dad die, that was like one of the hardest things. Like right after that, because I had suicidal thoughts, I had
Mhm.
anger, I had just trying to get off of the Cymbalta, which I'm still not off, but I went from 60 milligrams to 20 milligrams, which I think is, it's a third less than I was on. It's the minimum dosage. So I think that's awesome. And I think after the holidays and with more ketamine treatments and stuff, I think I'm going to, like in April, I think I'm going to try to tackle it again and maybe get totally off Cymbalta. Because I feel I'm at a point where I can be off the antidepressants now. I just don't want to suffer through the withdrawal symptoms during the holidays and everything else. Because those were rough. That's the roughest thing yeah, that was rough. Mentally was
Oh yeah,
terrible.
coming off that stuff's horrible. That's one of the reasons
Yeah.
that it's so hard to use. So hopefully they'll be able to, as you start using more stuff. So check your hormones as well. If you get your testosterone up, that'll help. Really refill those neurotransmitters. A lot of your serotonin's made in your gut. So there's lots of things you can do to kind of balance that and help get off the medication. But yeah, man, if you can get to the point where you can get off and feel normal again, that's going to be a spectacular piece for you. So run
That's
through.
what I'm working towards, but that's kind of how I got into the ketamine portion of it. I mean, I've never done anything besides marijuana. Like, and that's only at night. Like I like to have control. I had never done, like, I never experimented with that. I don't even drink. So I never experimented with anything when I was a kid. So it's for me to go into this and do like some psychedelics. It took a little bit for me but I was at that point, I was desperate.
Yeah.
I didn't want to, I didn't care,
Well, that's
you
that's
know?
why I like doing these things, because it's like, if we can get these stories out, maybe people don't have to wait as long, torture themselves as much before they can get the care they need. So I appreciate you helping us out. So, but go ahead, continue with your ketamine story.
Yeah. So no, so when I started this, I went through a thing called Mind Bloom, where they do it at home. Cause
Mm-hmm.
I don't know any other program where you're able to do it from home without the intravenously, because we do have places that do IVs around Detroit,
Mm-hmm.
and I wasn't doing that with the
Yeah.
IV. I'm not comfortable. I'm good. So I got into that. I started with anxiety. Each week I felt a little better. There's some weeks I feel like awesome. It seems
Mm-hmm.
to be that. And then we talked, and I dealt with that last week. But we could talk about that more later. But that's kind of why I got into it. But I'm not one to experiment with anything. It's like, and I'm not opposed to it. I'm open minded, but at the same time, I wasn't seeking it to get high or anything else, and I wanted to do it the right way. And then once I saw a person that we both look up to kind of post about it, that's when it was like it clicked in my head, like, oh, maybe I really need to look into this, because he seems like he's doing a lot better with it, and he says he's doing a lot better. So, and I could not find I tried to find something bad, and it should be easy to find something bad on Google. Like the negative pops out. And I
Yeah.
literally, like, the only thing, even with the ketamine places around here, the only negative Google reviews you see is some people that probably are a little more high maintenance. And they're like, well, I didn't get the care level that I needed from the doctor. Nothing about the ketamine, nothing that the
Right.
ketamine didn't work, just that they didn't like the staff. Well, that's no, So
Yeah.
obviously it does work. So after I did my research, um, and really dive down and tried to find something negative, and I just couldn't, that's when I decided to make the jump and pay the money because it is a little expensive and insurance doesn't cover it. But I mean, to get your peace of mind back and get yourself back I mean, it's been 2
Oh,
years of hell
it's huge.
basically, and I'm starting to get back to where I was beforehand. I don't think I'll ever I don't know. I've this first time I've lost parents and only time, but
Yeah.
I don't know if I'll ever be 100% back, but I'm hoping to get pretty close to there or better than, but I know I just got to keep working on it. And the ketamine has significantly helped.
Good. Very good. Um, how about the difference in help between when you and I talked about the setting and intentions and how to build that in your mind versus the other ones you did? Did you notice a significant or any type of difference
Yes.
in how you? Okay.
Yeah. So we discussed I discussed some things with you for about a half hour and just kind of went over some of the things that I was dealing with, because I was trying to get the most out of it, because this is expensive. And when they don't, you don't have too much guidance, they want you to kind of figure it out on your own. And, and that's great. But when you have anxiety and and somebody's so desperate for results, and you tell them, well, you got to set an intention, but then you just got to let it go. And that's basically all you say and all you get. Yeah. It's like, okay, now I'm worried about setting this intention. Am I doing this right? Am I doing, because all the anxiety kicks in. Right. And so, yeah. And so it's like, you can't tell, you got to kind of give anxious people a little more direction to help them get over the anxiety. Because then there's all these things are just running through their head, and you're just like, I don't know what I'm doing. Am I doing the right thing? And then you're in it, and you're just like pure consciousness. And you're like, you're even thinking in it, like, am I doing this right? Or am I, am I doing what I'm supposed to be doing? Or
yeah. And that's why, ahead of walking people through it is, I think, pretty important. That's why I wanted to make sure we chatted about that. So, but yeah, go ahead. You knock it out as we
yeah. So when we
walk through it.
Yeah, when we talked, you thought that I needed to, and I think I did. I think after we talked, I had a realization that my mom died. My mom's funeral was on a Monday. The ambulance called me on a Wednesday for my dad. So literally 2 days. I had one whole day in between her funeral, and they called me at 6 a.m. on that Wednesday. So I literally had one complete day to try to process or anything. And then I went right into my dad. Yep. And I think I had packed my mom, not intentionally, but I think I packed my mom in the back of my head to deal with my dad, and then, deal with my mother-in-law 9 months later. And I just never dealt with my mom. And so talking to you, you said I should probably try to say goodbye to my mom. And I went in with that intention of saying goodbye to my mom. And yeah, I basically, when I went in, I'll get vulnerable with you. When I went in, I had like a conversation in my head with her, kind of told her goodbye. She wasn't there. It's not like she was talking back to me. But I could hear what she would say, because she's your mom. Yeah. So you kind of know like how that person's going to respond, how this is going to go. So it's kind of like I did have a conversation with her head, but I didn't, because I know she's passed. And it's not like ketamine's great, but it doesn't connect you to the other side. Yeah. So, so I did that. And then afterwards I got super emotional. I had to call my aunt. I like cried for like an hour. Like I haven't since they both died. And there's been times where during this process where I've wanted to, but I think us as men, we hold that inside and we don't let it out, and that's not good either. No. Like there's sometimes you need to cry and you just don't, and you hold it in, and then you hold it in until you explode, and that's part of the anxiety and what causes this. So, and then the next day I was kind of in grief, felt a little still a little depressed, a little sad, and a little angry, because that's grief. And then I'm good. Nice. Surprisingly, the day after, I'm good. So
a lot of times what
I think I made peace with it.
Good. Yeah, you get that closure and everything kind of like falls in place where it's supposed to be. So, and that's one of the things that I'm glad that we got to talk about and set that intention of specifically meeting with mom, and like the ideas we're going through and what you were needing to go through and get, because a lot of times, again, we are, like you said, you're not talking to mom, you're talking to your own head, you're talking to your subconscious. And so implanting those messages back into your head that we've done this, we've broken through, we're okay, works really well, and it's really important. And so that's the big piece. So I'm real happy that you were able to get that through, especially because you were taking a little bit more than you probably should have or needed. So that piece was helpful as well.
Yeah, probably. Yeah, I think I fell asleep a little bit at the end. I think it's because it relaxes you so much that you do end up, falling asleep here and there. But, I was awake for the majority of the session.
Well, good. No, like especially these last seasons. So I'm glad I was able to kind of chip away at it. So as far as the mom piece and everything, how's the rest of the quality of life and getting the joy back to life and that type of stuff? Has that come back, or is it almost back?
We're getting there. Um, I think I still got a lot of work to do. There's a lot to take on. And my one brother's in North Carolina. My other brother, I'm the only one that has a business. So I'm a little more flexible if I need to be,
Mm-hmm.
you know. So I was there with my parents like every day for like 2 months in the hospital. Now, obviously, I wasn't there with my mom because they quarantined her, and it sucked. It was over her last Christmas. And I like begged. I thought I was a good enough salesman to talk those nurses into at least letting me put some PPE on and letting me go in the room or at least see her
Yeah.
through the window. And they were yelling at me because I was even on the floor because it was
Yeah.
during the real bad part of COVID. So, and people didn't know what we know now and everything else. So, um, yeah, but it's getting there. I was able to, I couldn't before, like, I love my nephews and I couldn't like watch, like, I couldn't get them gifts even for like a birthday without seeing them. And I'd break down.
Mm-hmm.
I just cry. And I'd have to hand the phone to my wife and that's gone.
Really?
Since I've done ketamine. So that stuff's gone. So I'm able to enjoy that. It's like it's the good times. The bad times you really don't want to. You don't want them there. You don't miss them during the bad. Maybe I miss my dad and my mom. You want some advice or whatever. That's what you miss. But you don't want them to see the bad times. It's the good times, and
Yeah.
you want to enjoy those good times. And so I am starting to get there. It's the ketamine's helping it a lot faster than anything else has. But you also have to, like you said, you have to have the right intention. You also have to work at it. You can't just take the medicine and just that's it. That's all you do.
Yeah. Yep. And that's a
So
big piece that I hope that people are starting to learn as well. Like, I tell people, like, a therapist is a great thing to go grab, before or during, especially afterwards. But some people can't make it through. So that's why I wanted to kind of brush up and kind of show people that the intention piece, the setting your mind in the right position and right place for this ahead of time, does in fact help quite a bit.
yeah, it helped me like after we talked, and I mean I was working on different things, but I think after we talked, you recognize that I really needed to work on that still, and that's
Yeah.
actually helped me. So having the right intention, but it gets confusing because they're like, "What's that intention?" And then you're like, okay, well, how do I do it? Well, you do it like this, but we're not going to help you. Like,
Right.
you got to figure out how to set your own intention. It's like, well, sometimes we're not aware of what we need. And then someone talking to someone like you can pick up you can more pick up what we're not aware of and be able to, assist and help out. And that's what is exactly what you did. So I appreciate you.
Absolutely, man. I appreciate you coming on and kind of helping kind of shed some more light on this, because the biggest thing is that people don't know about ketamine. Like, so I'm glad that you got to find out about it earlier. But there's so many people who don't know, and like, I'll explain it to people for addiction or for depression or for PTSD or whatever it is, and they're like, "Why have I never heard about this?" And that's always the thing for me. It's like, we've got to get out and tell people. And I tell people on our team all the time, I'm like, there's gonna be people who commit suicide because we don't get to them in time. The information doesn't get to them. And so I really appreciate you coming on and kind of telling your story so that everybody can kind of see it and be like, oh, I got a lot of things that I got the same stuff. And so maybe they, take the option of, jumping on some ketamine before they start doing either, the drugs that make you a zombie or, doing something worse to themselves.
Yeah. And it's okay to be messed up. I think we're all messed up in our own way.
We are.
We're all dealing with a lot of stuff. And then when you go through that much in this such a short period of time, you really face it, and it can really be a negative. It really throws you into a negative spiral that you can't get out of. And this has helped me. Yeah, but a lot of people I talk to, they're like, "What's ketamine?" Like,
Yeah.
and then some people are like, "Oh, that's Special K," and it's like, "No, I'm not getting off the street." It's so yeah, so you kind of got to explain it to them in that, and then there's still some people that because it is psychedelics, there's still some people that they're worried about me or like family members, but they see now that it's working and they've changed their mind and stuff like that. But at first, it's like, no, I'm not just taking acid, or I'm not going on the street and getting ketamine and treating myself, or, or getting something, because, so much, street drugs are laced with fentanyl now. And there's so many people that are
Yeah.
not doing good and dying. And so I get the worry, but it's like, no, this is a legitimate thing. Because, some people hear ketamine and they're like, oh, that's a street drug, or, this and that too. And it's not. I mean, so.
Yeah. Well, it's the number one drug used in pediatric surgery. It's one of the number one drugs used in L anesthesia. Fentanyl is probably number two, the highest use, but it's the safest one we know of. It doesn't affect breathing centers, and so you still breathe. And so it's one of the safest ways to go about it. All of the psychedelics are actually, from research, very, very, very safe. Ketamine is just the most easy access legal one that we have access to, and it works really well because it lifts all the receptors, the dopamine, the GABA, the serotonin, it lifts them all up. And so that's one of the things that really helps kind of break patterns and break, you're in this rut, you're feeling terrible, like it helps kind of kick you out of those things so you can reprocess and design your own life again. So, but it's awesome.
Last year I was a mess. Especially during the holidays. This year I'm able, and it's been rough even this year with all that piled on top of each other. I mean, it's really only been, this is like going on 2 full years.
Yeah.
And anytime I would talk to like a therapist or anything, their eyes would get all big when I told them, my mom, what my story. And I'm not trying to impress, my job is not to impress the therapist with the trauma that I have.
Yeah.
For them to be like, oh my God, that's dude, really? That's a lot, and it's like, man, do you even know how to talk to me? So, but I've been through that. I talked to a therapist. I did all that stuff.
Well, yeah. And
like I said, I was on some Volta. I haven't. Yeah. No, you're good. I'm done.
Oh, okay. Well, yeah, and the research is showing that, psychotherapy or talk therapy is very, very helpful, especially during and after the ketamine. But it's kind of like doing a year or 5 or 10 years of therapy all in one little session with the ketamine. That's one of the things that really, really benefits, the therapy if you're doing it with psychotherapy. That's why ketamine with psychotherapy is so beneficial.
Yeah. So, but without it, I don't know where I'd be right now with Christmas coming up in a few days, and I don't know where I would be mentally, honestly, without this.
Well, if you're starting to feel bad, it's one of those things that, jump on it, but make sure you get it early, because it's one of those things that once you start down the path a little bit too far, you want to make sure you call somebody and talk to somebody before you start running some ketamine again. But, that's fantastic, man. I'm glad that you're in a position now where you can go through the holidays. We're not too far off. If you can go through the holidays and feel better, be functional with the rest of your family, still have that joy. That's a giant, giant step. And I'm super excited that, ketamine is able to help you out.
Yeah, no, I am too. And I'm glad that I found it and our friend posted about it. Cause like I said, I was trying to find different things because I was desperate to get out of this, but I just didn't know what. And I just didn't hear about the ketamine thing, so yeah, it's just kind of making awareness about it. Cause I really don't think it's surprising, like how many people just don't know.
It is.
They have no clue.
Especially with the giant, giant need we have in the country. I mean, depression, anxiety, PTSD, addiction, like that's 100 million people. It's more than that. It's all of it. So, but yeah, no, I'm glad thank you for coming on and helping us out, kind of gain some awareness and that sort of thing. So it's been really beneficial. We'll keep moving forward. And, once you've kind of gone through a couple more, if you're like, hey, I want to come back and talk about X, Y, and Z, let's 100% do that. Stay in touch. Don't want to make sure that we get any information out. So if you're like, hey, when I did it this way, it helped me to, set the intention this way, or to, set the setting and the mindset this way. It really helped me on this thing. That information will help, come back as well. So we're going to start a Facebook group for everybody so everybody can kind of talk a little bit. The Wellness Insights Facebook group, I guess, can work for right now. We'll change the name sooner or later. But that would be great. So, if you're ever there, if anybody needs to check anything, we'll be there checking on it. So, but no, I really appreciate it, man. So, like I said, we'll check back with you and have it test it out later. So, thanks so much for coming.
All right. Thanks, brother. I appreciate you.